Hello everyone, this is Dr. APARNA. I work as a consultant neonatologist at KIMS Cuddles, Kondapur, and today we are going to discuss about a very important aspect of neonatal care. How can we prevent infections in our newborn babies? Infections along with prematurity and birth asphyxia comprises one of the three most common causes of neonatal death as well as neonatal morbidities, which means diseases which require treatment or care in an NICU. We all know that newborn babies are much more vulnerable or at risk of developing infections when compared to bigger children or when compared to adults. This is because of their immature immune defense mechanisms. All of us have inherent systems to fight against or to prevent infections, which comprise the antibody-mediated immune system, which is humoral immunity system, and the cell-mediated immune defense mechanism. Both these types of immunity are deficient or less developed in newborn babies compared to bigger children. And also some of the inherent barriers which prevent infections, such as the skin, are also less developed in newborns. When it comes to newborns who are managed or who are hospitalized in a NICU, they are at risk of infections because of various other factors, which include frequent handling of the babies for insertion of lines such as IV catheters, peripheral lines, central lines, endotracheal tubes, administration of drugs, administration of medicines such as surfactant, etc., etc. With all these factors and with the decreased immune defense mechanism, newborn infants are at a very high risk of developing infections. Now, when it comes to the types of infections, we may have infections due to bacteria, due to viruses, and due to fungal, and some other rarer types of infections. Now, when it comes to bacterial infections, studies have shown that the type of bacteria infecting newborn babies can depend on the type of the socio-economic system of the country. Say for instance, developed countries, we see different bacterial infections when compared to the developing nations or the lower and middle income nations. And we also see that it depends on the type of interventions or the type of invasive procedures which are performed. So when we have more commonly central lines being placed in newborn babies, the type of bacteria which infect them are found to be different. By and large, in developing or lower and middle income nations such as India, the commonest type of bacteria are the gram-negative bacteria, amongst which there are bacteria such as Klebsiella, E. coli, which are all found commonly in newborn babies, and a recent study has found that another bug called Acinetobacter has been found to be very common in newborn infants. Newborn infants may also develop infections due to viruses. One of the viruses which we all heard a lot about in the recent times is the SARS coronavirus 2, or the virus which was responsible for COVID. Similar to this, we have so many other different types of viruses which may be responsible for respiratory as well as gastrointestinal infections. Sometimes viruses such as herpes can also cause infections in the newborn baby's brain. In addition, there are another group of organisms called as fungal infections, which may also be seen in a particular group of newborns who are highly susceptible to these type of infections, particularly babies who are very preterm, born with birth weights less than 1000 grams, or who have had extensive invasive interventions performed on them, such as placement of central lines or ventilation for a long duration. To understand this, we must know the ways to prevent infections at home and the ways to prevent infections in the hospital. When it comes to prevention of infections in a newborn baby at home, first and foremost, remember that our hands are one of the important sources of contamination or carrying fomites or infections to the babies. So hand washing, which includes washing the hands with soap solution for 40 to 60 seconds thoroughly, making sure that all aspects of the hands which come in contact with the baby are thoroughly cleansed, is the first and most important step in prevention of infections. Ensure that your hands are washed every time before you touch the baby, and also before and after you handle the baby's diapers or prepare feed and give feed for the newborn baby. Now, the second important aspect of care for prevention of infections is the care of the skin, the care of the umbilical cord, and the care of the eyes of the baby. So remember that newborn baby's skin is blessed with an acidic mantle, where the pH is between, say, 5.5 to 6.5, and this is one of the natural mechanisms of defense against infection. So this has to be preserved by use of an appropriate cleansing agent, also called as Syndex, in newborn babies. So you have specialized soaps or cleansing agents which also come with the same acidic pH, and do consult your pediatrician before you choose the ideal soap for bathing your newborn baby. Also, it is important that the umbilical cord of the baby is kept clean and dry, and one must avoid the unnecessary applications of antiseptic powders or solutions or cleaning agents routinely over the umbilical cord. If the application of an antiseptic solution is required based on the signs of umbilical infection or stump infection, this has to be confirmed by your pediatrician. Also important to ensure that the eyes of the newborn baby are kept clean. Avoid the application of agents such as kajal, which may be not only irritating but capable of introducing infection into the gentle eyes of a newborn baby. Again, the other important aspect of the care of a newborn baby is to avoid overcrowding, is to continue the care of a baby in well ventilated rooms, and making sure that those persons who are suffering from cold, cough, flu-like symptoms and fever avoid close contact with the newborn baby. If you are having pets at home, make sure that the pets are taken care in an area which is separate from the area where the newborn baby is cared for, and this precaution may be required at least in the first few weeks of the care of a newborn baby. So these are all the ways by which you can take care to prevent infections to your newborn baby while you are taking care of the baby at home. In hospitals, where we typically take care of small or preterm babies or babies with some sickness, there are some additional precautions that we need to take. Of course, the regular steps of hand washing, and remembering that hand washing or hand hygiene should be performed before we touch the baby, examine the newborn baby in a neonatal intensive care unit, or before any such invasive procedure is performed, is of utmost importance. But also, in addition to this, we have standardized checklists or bundles of care which include various steps of appropriate care that are to be taken, or various precautions that are to be taken before performing any invasive procedure, such as insertion of an intravenous line, or insertion of the endotracheal tube, or performing endotracheal tube suction in a ventilated baby, etc., etc. These checklists and bundles help us drastically to reduce the chances of infection in a neonatal intensive care unit. And very, very importantly, remember that there are some preventable infections which can be effectively prevented by maternal as well as newborn vaccination. One of the important examples is pertussis, which sometimes we do see even in a newborn baby. Now, this can be prevented by taking the vaccination appropriately during pregnancy, and this is something that you need to consult with your obstetrician. So with this, we have discussed what are the ways to prevent infections in newborn babies, and do remember, prevention is always better than cure. Thank you.